Okay, Dr. Huebner here, Natural Transplants. I'm here today with the patient of the day, Scott. And Scott's really great patient because he has a great hair type. He's a great guy. He's actually a medical student, so he's in the medical field. And so we've been talking on the phone about different things and talking about the medical field in general. So it's going to be a real fun day. But I wanted to show you what Scott looks like before we start drawing on his head and doing everything. So, obviously everyone's nervous when they come in and everyone leaves saying, that was it. So you can see, and I'm going to show you some pictures in the video what he used to look like with hair. He actually had a really strong hairline just a couple years ago. So a lot of this is kind of started over the last couple years. He still has some pretty solid hair on the side and the back. He still has some hair through the middle section here. So we're going to talk about what we want to do as far as we need to do the hairline in the frontal third, and then whether we want to attack the crown or whether we want to just work our way back. So there's a lot of options, and it's nice to have those with Scott here. So I wanted to show you though, what he has is a typical pattern of recession on either side. He still maintains a little bit of this central tuft here, but what really excites me and gives me goosebumps is his donor. So he has a really nice, thick, dense hair type, which is really good for transplants. So again, it's like a mean trick. You got all this great hair on the sides and the back and not much on top. So this is really going to make a huge difference for him. You can see the quality of hair that's left on the top in the center. It's very miniaturized and soft as compared to the hair on the side. So putting different type of hair back that's resistant to that to the hormones makes a huge difference. The hair quality is thicker like he used to have. So, but I'm very excited. We're going to show you his progress, and I can't wait to see his results. Okay, Dr. Huebner here. I'm here with Scott, and Scott's I don't know, about a third of the way through the surgery. I just wanted to show the what we've done with the hairline. So we've drawn out the hairline. Now, Scott has allowed us to shave his head, which is very nice of him to let us do that. Again, it's not mandatory, but you can see when we jam-pack this full of grafts, it makes it much easier to wash and to take care of. But in his case, he's able to take a little bit of time off school, so no big deal. But you can see what we're going to do to his temples, actually. We're going to bring his temples out, and that's going to make his forehead look a little less wide. So it looks a little more narrow, more youthful. And I bring it around here and show. And see the side. You can see what it's going to do for his profile. Makes it completely different. So, Scott, how's your day going so far, man?
It's going well.
Awesome.
No complaints.
Any pain? How painful was the anesthesia?
Not too bad. Just a couple pricks,
Okay.
But other than that,
You're not talking about me, right? You're talking about the pricks of the anesthesia, right? Okay, good.
Right.
Okay, good. So, just kidding. So, you can see from the back here, what we've done is taken the strip out. In Scott's case, we were able to get more than the standard centimeter wide strip. We're actually able to get some more because of his good elasticity. You can see from the back, you can't tell that anything's happened, other than us shaving his head, of course. But it's completely hidden from view. So I'm going to kind of show you the top here. What we've done is we mapped out 3 different areas. Now in Scott's case, we're electing to start from the front and work our way back into the crown area. Now the crown is more responsive to medications like minoxidil or Propecia than the front would be. So we're going to basically hit the areas that are more drug resistant. And hopefully with the Propecia and the medications, the crown will bounce back. He has plenty of hair to do what he wants as far as hitting the crown in a future date. So looking forward to some great results, man, and we'll check back with you through the procedure.
Awesome. Thanks.
Dr. Huebner here, Natural Transplants. I'm here with my patient Scott. So Scott has completed the surgery. So congratulations, my man. How was the surgery? How was the day for you?
It went by really fast. Not much pain at all.
I think you took a nap, actually.
I did. I fell asleep for quite most of it.
We watched a couple episodes of Dexter.
That's right.
And it was really, pretty unremarkable day. But unremarkable for him, remarkable for me because we got 3 strips, so we got a nice amount of tissue, almost 40 square centimeters of tissue. So that's going to yield in close to 8,000 hairs.
Awesome.
So what we did is you can come in here a little closer and see what we've done. So in his case, we've lowered his hairline, obviously recreated his hairline, I should say. And we've actually done his temples as well, so you can see where his new hairline is going to be, nice and staggered. Now this line right here is a little bruised from where we did the needles for the anesthesia. That will fade in a couple days. But you can see how we built out his temple quite a bit here, and that's going to give him this narrow forehead instead of giving him a wider forehead. So this is going to be tremendous. And you can see how nice and tight the grafts are. Each one of these grafts in the middle section here represents 4, 5, 6 hairs. These are density grafts, multiple follicular units that are going to give him density. And you can see that, most people have a little bit of oozing here and there, but the bleeding is very, very minimal. If you want to come around the back here, I can show you what the incision looks like. So just from the back, no one can tell what's going on. Everything's completely covered. You can see that he has a suture line right there underneath the hair. and it's completely approximated. As if someone took a pen and drew a line. That's how big a scar should be when it finally heals. So some of the tricks to having a suture line that's undetectable is resting after surgery. So as I explained to Scott, no going to the gym for 10 days. That's when the sutures come out, in 10 to 12 days. No heavy lifting, nothing to get your blood pressure up too much. He's going to want to sleep in a semi-upright position for 3 nights, about a 45-degree angle. We provide you with an airline neck pillow. And he's simple, simple, simple. Tomorrow he's going to do a rinse in the shower. The following day, shampoo and conditioner. So simple stuff. As all patients know, I give them my cell phone number to call me anytime. 3 in the morning, 4 in the morning, doesn't matter. That's the beauty of having one patient a day. So really excited to see your results, man. And also coming from a medical professional in medical school, this is going to be unbelievable. It's going to change everything for you. So congratulations, and look forward to seeing your progress.
Awesome. Thank you.